Hello, everyone. So, we are going to be talking about my favorite topic, how to improve digestion. This is like the $1 million question. I think a lot of people have issues with digestion. To present this topic with us today, we have Dr. Jessica Wu. She's a naturopathic physician from British Columbia, Canada. Welcome, Dr. Wu.
Hi, thank you so much for having me today.
Great. So let's just talk about what are the common digestive issues.
The most common things that I see in my practice are probably what many of you experience, range from constipation to diarrhea, and this often goes along with abdominal pain, where you get that bloating, that sensation that a lot of you probably have become accustomed to and think, oh, this bloating is normal, but that is not, and I find that those are the most common things that I see, as well as the indigestion, the stomach pain, as well as the acid reflux that comes with that sometimes.
But what are the common causes for digestive issues?
Everything, I would say, starts with the diet, of course. And as many of you know, certain nutrient deficiencies, if you're not taking in the right amount of minerals, fiber, those can all contribute to either the constipation or the diarrhea. Of course, certain foods you eat, such as excessive sugars, those can cause a lot of the bloating and the gas as well. And then if you have certain food sensitivities, which is something I really focus on in my practice, those can also cause a lot of mayhem. And a lot of people are sensitive to dairy, gluten, etc. And I find that just adjusting these things in the diet really, really help support better stools.
So let's just talk a little bit about leaky gut syndrome, right? People talk a lot about that, but I think we just want a deeper understanding.
Yes, absolutely. So leaky gut definitely is a very popular topic right now. How it works essentially is if, for example, you have a food sensitivity that you've been eating for a long time, and a lot of us are not aware of what is causing that inflammation in our gut. But say, for example, you're having a lot of dairy, and that dairy starts to cause inflammation in your gut lining. And what leaky gut means is that the cells in your intestinal wall are no longer nice and stuck together. Your cells should be kept together by tight junctions. And what leaky gut means is that these tight junctions start to become weakened. And so your intestines become more permeable. Bacteria and toxins and proteins that should normally not go through there start to enter. And this is the concept of leaky gut. And so this can lead to symptoms such as the bloating and fatigue, constipation and diarrhea, of course, but you start to notice them more systemically. So you will get the brain fog, low energy and whatnot. So that's the idea of leaky gut there.
Okay. And then so you talk about constipation, you talk about diarrhea. So how do you define constipation?
Constipation, I always refer to something called the Bristol stool chart. Maybe quite a few of you have heard of it, but if you Google search it really quickly, you'll see that it numbers all the different types of stool that people usually have. And so type 4 is the nice, banana shaped, it's smooth, it sinks, it's nice light and brown. That's the one that we want ideally. And typically the frequency of bowel should be close to how many meals you have in a day. So 2 to 3, depending on the person. And when you have constipation, you'll see that, it's pebble-like. You have these hard stools. They're in chunks. They're dry. You can see cracks on them. You have to strain to have a bowel movement. And oftentimes because of this, over time, you start to have blood or hemorrhoids that come with that. And then, of course, diarrhea is the opposite. You have the ragged edges. It's not well formed. A lot of these stools start to float in the toilet, which means that you're not digesting your fats very well. And so that is the other side of that spectrum on the Bristol stool chart. So I always refer to that, to just keep an eye on how your stool is doing and knowing what your goal is in the end.
So let's talk about 2 spectrums, right? The constipation and the diarrhea. So what type of foods, I should say, cause constipation versus diarrhea?
The types of foods that cause constipation, it's more Of course, when you have a lot of very carby foods that are highly processed and you don't have a lot of the fibers, it's essentially the lack of the fibers that's causing that constipation. And so I always recommend that people have, half their plate to be more plant-based, right? They have a color of a variety on their plate. So having their dark green vegetables, or having the yellows and the oranges and the reds, those will all help to help the stool to move along. And of course, hydration. If you don't have enough water, your bowels or your stool will not have enough water to absorb and to move that stool along. And so those two things are really, really important when it comes to constipation.
And diarrhea. Well.
And for diarrhea,
Mm-hmm.
So for diarrhea, I find that something that's really helpful are soluble fibers. And so soluble fibers are different than insoluble fibers. Again, they bring bulk to the stool, where it's, with diarrhea, you have kind of water that's imbalanced, and so you have watery stools. And what soluble fibers do is it actually helps feed really good bacteria in our gut, and then it brings the water into the stool, so it keeps it nice and bulky. I find with people that have diarrhea as well, you want to make sure you have good source of electrolytes. So in your water, you want to have, you can put some lemon or have some coconut water, different things to make sure that the balance of your the water and the electrolytes are healthy in your body. Another thing about diarrhea I want to mention is a lot of us have this tendency to eat when we're really stressed out. So if you're at work, you have a shift, and then suddenly you have your lunch break and you're not even sitting down to eat, you're just scarfing everything down, and you're not even paying attention to chewing. I find that we have this tendency to do this because we're so stressed out and we're not focused on our food. And so our body doesn't digest these things very well. We're not digesting it properly. Our body's focused on trying to do all of these other tasks, right? And in scientific terms, we call it the sympathetic mode versus the parasympathetic mode. Sympathetic is when your body is stressed and it's ready to run from a bear. You're on the go. So your body is not going to be primed to be able to digest the food you're going to take in during that lunch break. And so instead, you really want to sit down, enjoy the food, look at it, smell it, taste it, chew it, and just, let your body come into this parasympathetic mode where it's like, okay, I can rest right now. I can digest my food. I can absorb it well. And so when we have the stressful eating, I find that the diarrhea can come with that as well.
Oh, for the stressful eating. So a lot of us do that, right? When you're working, most of the times of lunch and learn, right? Lunch and work, I guess, and then working and eating at the same time. And that's the same. That's not recommended.
No. And so I always recommend to just that if you take anything away today, is to have this practice in your life, to sit down and mindfully eat your food. I really love when families sit down for dinner together and, we actually enjoy what's in front of us and appreciate that. Something I also really think is a good idea to improve your digestion, just a quick trick, and because I had mentioned acid reflux earlier and heartburn, is having some apple cider vinegar, and I have some on my shelf up there, having a couple tablespoons of apple cider vinegar with a little bit of water, and just having that about 20 minutes before your meal. That bitter taste in your mouth really primes your stomach for digestion, or prepares it for the stomach acids to release, and it just really makes the digestive process better. So that's a easy trick for anyone who's been suffering with acid reflux for some time.
Sure. So as a naturopathic physician, I'm sure you also use herbs, right? The herbs are in your toolkit. So talk to us a little bit about different type of herbs that can help with digestion.
With herbs, and it really varies on what the digestive issue is. If we go back to leaky gut and we talk about just trying to heal the gut lining, there's a lot of different teas or tinctures or like capsules that you can take. I particularly really like marshmallow root, and slippery elm. Those are really good ones to help coat the lining of the stomach. Licorice is also a really good one for that as well, essentially just to improve the lining. Gives it that kind of a mucus lining so that it's protected, and the cells just have a much easier healing process with those herbs. In terms of other ones, berberine is a really good one as well, if we are worried about stomach acidity. And yeah, there's so many herbs, but I would say those are my favorites for leaky gut.
Okay, and then what about constipation and diarrhea? Are there any herbs or just the food itself?
Yeah, in terms of constipation, I would say, and just a really quick fiber that to add into your life, like it's a food, flax seeds. I would say 2 to 4 tablespoons of flax seeds in your day is really good for not just for digestion, but also for your heart. Helps with blood pressure. If you have high blood pressure, it'll help bring it down. If you have blood sugar that's quite high, it'll help regulate that a little bit. And so flax seeds is one of my favorite recommendations for constipation. And then if you're really constipated, taking a psyllium husk supplement, those can be helpful as well. Mm-hmm.
And what else as far as GERD is another problem, right? Is GERD and acid reflux the same thing?
Yeah, GERD and they're pretty synonymous. Essentially like that burning and the sensation that you get, that heartburn, that sphincter that connects your esophagus to your stomach is weakened. It's not functioning very well. And so there's definitely some controversy of what is the cause of that. But essentially honestly, that apple cider vinegar will probably do wonders on majority of people that have the GERD. And, it's just finding the cause. What is causing that GERD to act up? Is it your smoking that's causing some weakness there? Is it the spicy foods that you're having all the time? Is it the caffeine that you're drinking too much of? It's just trying to find out what is the cause of the GERD and then and removing that.
Yeah, sure. So, all right, to summarize, what are the 4 or 5 things that people should use? I mean, we talked about the fiber, we talked about something. You want to summarize what 4 or 5 things?
Yeah, and it's so individual, of course, if you're suffering from constipation or diarrhea or whatever the cause is, and before, you go and pick all these things off the shelf, you always should go see a healthcare practitioner, do your research, make sure that your stomach pain isn't something more serious. We don't want to just treat it as if, it's just constipation, but there's something more that's going on, right? So consulting with someone, but I find with constipation, if you have abdominal pain, you're constipated, I really love castor oil. This is something that you can apply topically onto your stomach. And so usually what I do is I take the oil and do this before you go to bed so you don't have to worry about it. And you just rub it onto your abdomen, especially over the liver. Take a heat pack and just put it over that. And then wear an old shirt because the oil sometimes can stain. And you just go to sleep with that. That castor oil is it's a powerful laxative if you ingest it, but it can work well topically as well to move the muscles around in the intestines. It helps to remove toxins, and it's also anti-inflammatory and relieves pain. So that's why it's helpful for the bloating and the cramping that you can get with the constipation there. Of course, you want to avoid this if you're pregnant because it can cause a lot of muscle movement in the belly, and then if you have any allergies of some sort. So I find castor oil is really, really excellent. Another thing that you can think about taking is something called L-glutamine. L-glutamine is an amino acid, so it builds proteins in the body, right? This is really, really important for your intestinal cells. It's a really good energy source, and that's what really helps with the leaky gut as well, to protect against it. You can find this in a lot of foods, different foods like cabbage and spinach and tofu. Like these all have some L-glutamine, but of course they have the powdered form where you can get a really big dose of it in a scoop. I also really recommend the probiotics, that's all the rage still, to balance the levels of bacteria in the digestive system. I've seen so many people just test in their stool. There's some really great tests now you can do through naturopaths to see your levels of gut bacteria, see if there's a balance or an imbalance, and if there's some that you need to increase and some that you need to kill. And so doing the stool test, you can really identify which bacteria you need to increase in your body. And so probiotics just makes such a big difference for people who have abdominal pain and any sort of bowel issues there. And then lastly, I would say I do a lot of acupuncture. So acupuncture, again, is just balancing the whole system. As much as everything starts in the gut, everything is also connected. how you mentally process things, your hormones, and all of that. So acupuncture takes a really good holistic approach and addresses all of these in a really nice way.
Yeah,
So,
I love acupuncture, and I love the way you kind of outline different tricks, right? That we can do at home if we have a minor constipation, minor diarrhea, but of course, then everyone needs to see a practitioner. So thank you so much for being with us and sharing this simple knowledge of how to improve our digestion. Thank you so much, Dr. Jessica, for being with us today.
Yeah, you're welcome. Thanks so much for having me.
Yes, to all the viewers, learn all the tricks, right? Don't and check your poop. I mean, seriously, check your poop every single day.
Yeah,
right.
I always ask every patient, what does your poop look like? Even if they come in and they're talking about, their pain somewhere, I'm like, how does your poop look? It starts in the gut. Absolutely.
Yeah. So get to know your poop. That's the message for this session today. Thank you, everyone.